Hi everybody, it's the luckily not so late, but still also great Andrew Hutchings with you here tonight, not today, to talk about how to treat stimulant-induced exhaustion or concurrent exhaustion and stimulant use, one way or another, if someone is exhausted and has been using stimulants. So this one I'm not going to go in as deep and detailed as I normally would, save me some complications in a couple different regards, maybe a few different regards. And sadly, I can't get this to be standard practice or standardized into a standard practice, because actually there is no standardized way of doing this. Just, again, not going to get in too deep, so yeah. So to lay it on you, here's the big problem with stimulants and exhaustion. When you are exhausted, let's say you've been up for an extended period of time, the body's been through an extended amount of stress, heightened stress, from all the stimulant use and lack of sleep, lack of proper, everything added up together. The body is very tired, and it's been used to a heightened stimulus, heightened nerve signals to the heart, heightened everything. And remember, it's very tired. So if you go and you kill that stimulus completely with lots of sedatives, you can be in big trouble, because the heart, it was already worn out, but it was getting that heightened stimulus, keeping it going. But when you kill that stimulus, yeah, it's not going to be going as hard and as much, and that's good. The problem is maybe it's not going hard enough. Maybe you wipe that stimulus out enough, plus it's already been exhausted, that it's not enough to keep it going. And I do hope actual doctors are watching this, because I want it to be implemented into practice. I know you're probably thinking, oh, that's not going to happen. You don't wipe it out so much so it just stops beating. You have to have experience with stimulant exhausted patients. Yeah, that's all I'm going to say, and it definitely can happen. I know lots of people that are drug users, and more than one has reported that after taking sedatives to relax after a long bout of stimulant use, that they felt like their heart was not even strong enough to keep beating. And typically when you get some big warning sign like that from your body, it does mean something. It's not just, oh, you're tired or you're on drugs and your brain isn't working right. You're imagining it. No, trust me, if you feel like your heart's beating so fast and you're wiped out, exhausted, you think you're gonna have a heart attack, maybe you actually are. Like, take it seriously. You gotta listen to your body. Now, if you just smoke some weed and you're 20 years old, completely healthy, no heart conditions, and you think you're gonna have a heart attack, but your pulse is 120 BPM and your blood pressure is fine, yeah, that's anxiety. That's probably nothing to worry about. But it's a different situation if someone's been up for days on heavy doses of stimulants, lots of vasoconstriction, lots of high heart rate, blood pressure, everything. That's a dangerous situation, and when everything is so truly exhausted, if you wipe out... So first of all, you do need to relax the system. By system, I mean body. Because if you don't, it's gonna exhaust... It may not. Hopefully it wouldn't. Hopefully the situation isn't this bad already. But say the person has pushed their body to the limit. The body does need rest and relaxation, 100%. It needs it very soon. And proper hydration, nutrition, everything. But number one is rest and water. So you do need to use sedatives, but you must keep adequate stimulus for the heart, because if you sedate the patient too much, the heart could stop beating. And I know that's probably, maybe it doesn't sound crazy to you, maybe you have experience with this, maybe it makes sense for some reason, but I know there's a good chance that if you're a doctor listening to this, it's going to sound crazy. Look, stimulants aren't going to make your... Hey, they can normally make you... I mean, not certain... I'm sorry, not stimulants, but depressants. So let's say benzodiazepines. Yes, normally they're not going to sedate someone's heart enough to stop it. You could arguably say that they cannot do that. But regardless, in this situation, they can, because you don't need to completely block the signals for it not to be adequate. You could talk about barbiturates, which actually can suppress signals to the heart enough to kill somebody. And in this situation, it would simply take less to kill somebody. Sorry, like I said in the beginning, I'm not going to get deep into all this stuff, but you need to find something that's going to selectively get more nerve impulses to the heart, more better action potentials, so that it's doing good contractions. We're not trying to just stimulate it in a traditional sense. We're not trying to increase blood pressure, increase heart rate, and all that stuff. No, we just need to stimulate the contractions, because that's where you're going to fall short, is that contractile force. It is not going to be there if somebody is exhausted from stimulant use, for the two reasons of, one, they're exhausted, two, those stimulants had been stimulating the heart contraction. You take them out, it's already lower than it should be. Then you depress it even more, add in how exhausted they are. It's a recipe for disaster. Now, it's not always going to result in death, luckily, but it's not good medical practice to take that risk. So you need to find a selective thing that's going to just increase the force of the heart contractions. And if you're not a doctor watching this, I'm sorry I can't give more details into all this stuff. Maybe I will in the future. I like to limit the amount of trouble I can cause myself. It's always a good idea to think wisely. So yeah, if you're not a doctor, I hope you can figure out something about this. I highly encourage you not to experiment. I highly encourage you to talk to a doctor. However, and I was just thinking about this in the shower. So in my videos, I always say I recommend you talk to a doctor, but to be honest, most doctors are morons, like I called them in my last video. Now, not all doctors, but most are not very sharp. Most don't know how to do anything. Most can't think for themselves. They just know how to do what they were taught or trained to do. They can't think outside the box, they can't troubleshoot, and they certainly can't act on the spot to solve real problems immediately. Now, the doctors that can are the emergency room surgeons. Now, luckily, because I mean, we need somebody, and luckily there are some people that are able to think on the spot and actually do things that work. So yes, if you're not a doctor, I'm sorry, it's tough luck. Hopefully you have enough medical background, pharmacological background, and intelligence, or whatever combination of things you need to figure out this for yourself. Once again, obviously don't experiment. I mean, you shouldn't be taking those stimulants in the first place. And whereas I often say, talk to your doctor just to cover myself, liability reasons, when I say don't use drugs, I actually mean don't use drugs. Drugs are bad. They don't lead to anything good unless they're correcting some sort of problem in your body or deficiency or whatever it is. Basically, if they're fixing something, that's one thing. But if you're already healthy and you introduce drugs into the body, it is bringing the body into a state of disharmony. And that may sound like a fluffy word, disharmony, but what I mean by that is it's messing you up. It's not good. It's doing something bad. Now, maybe it's not doing something extremely bad, maybe it's just doing something a little bit bad, but one way or another, it's doing something bad. So hopefully someday there becomes some sort of medical practice for this, because, well, I don't think drug addicts are the greatest people. I'm not saying they're bad people, but honestly, they're just normal people who are drug addicts, but I also don't like a society of drug addicts. But regardless of all that, there should be good medical treatment if people are facing exhaustion from stimulants. Now, of course, if you just use traditional medical treatment of either letting them ride out the stimulants and keep their body in the exhausted state, but with the stimulus, yeah, you're probably gonna be okay. Well, I mean, if you're at the end of the line, then no, you're not gonna be okay because it can't take any more of that exhaustion. But yeah, but you don't face the problem of depressing the heart signals too much. But if you do the other traditional treatment of general sedatives, you do risk that. But if you're in a hospital setting, of course, you could inject adrenaline or use the electric things, and yes, I don't know the names of them, the paddles, the whatever the hell they're called. Believe it or not, knowing the names of things doesn't make you smarter about them. So yeah, if you're in a hospital setting and the heart does stop, you have methods of redoing it, but why get to that point? I don't think you should get to that point. I think you should do better treatment so that you don't get to that point. And I don't know how common it is that people actually die from the depressed heartbeat after stimulant exhaustion is treated with depressants, but it can happen. So just getting this information out there. Maybe a doctor will hear it, start figuring out a treatment and popularize it. Not even give me credit. I don't really care if I get, obviously I do like if I get credit. But mostly I just realize that it's stupid to wait until I'm a doctor to try to get this into practice. Plus, whoever tries to get into practice first is going to meet roadblocks, and I'd rather have those roadblocks cleared before I'm a doctor. That way I can just do the treatment without the roadblocks. Now, of course, this treatment might not have the biggest roadblocks because it's not necessarily an extreme treatment. But yeah, now I'm kind of just going on, and this is one of my videos, it's just something I was thinking about. It's not necessarily new thoughts, I've known this for a long time. But I figure there's no time like the present. I may as well just make the video on it right now, right here, and get it done with, get the good information out there. So to wrap things up and restate everything, when you're exhausted from stimulants, the body is both exhausted and used to an increased stimulus to the heart. So if you relax the body, which is something you need to do because you can't let that stress state continue if the body is completely worn out. So if you relax it, you suppress the heart stimulus and it's already exhausted. And it was already used to an increased stimulus. So now you're going from so this is normal, you're going from a higher to normal down below normal, plus it's exhausted. A recipe for disaster. So yeah, you gotta selectively stimulate the heart contractions to make sure they have enough force to keep going. What you use to do that, it's up to you to figure that out. I don't suggest you do any experimentation with drugs. I don't suggest you use drugs. I'm against drugs. I think that you should be healthy and not use any drugs. Please like and subscribe. Check out my Instagram where you can hire me. Well, I mean, check out my Instagram to check out my Instagram, but you can also, after you check out my Instagram, hire me for coaching, diet plans, nutrition plans, supplement plans, fitness, weightlifting plans, strength improving plan, whatever kind of plan or advice or anything you want, just let me know. It's not like I have X, Y, and Z plans you have to buy. It's just like, hey, can you help me with this? Sure. But if it's something I don't know about, then I'll be honest and I'll, hey, I don't know enough to have it worth you paying me money for it. Maybe I'll figure it out because I like learning new things, and then I'll get back to you and have you pay me, considering I just did the hours and hours or days or weeks or however much research, because I don't like to just touch on the surface things. I like to truly know about them. And then I'll charge you for my advice. Muscles have been looking, mostly it's actually the skin covering them, but since I got this HPV vaccine, my skin has not been the greatest. Plus, lately I've been having a lot of trouble with shaving and getting, you can't see it as much on the chest, but shaving has not been going smoothly. I don't know how bodybuilders do it. So yeah, stay healthy. And I do not recommend any drugs